I just talked with nurses from Colorado that are saying it's normal in the ICU to have 4 patients. The recommendation in ICU is 2 to 1 or sometimes even 1 to 1, and they're taking 4.
I said that we've got a nurse on the line from South Carolina. Her name is Hannah Drummond, RN, in the emergency room at Mission Hospital in Asheville, North Carolina. North Carolina, not South Carolina. I apologize, Hannah. Working at Mission Hospital in Asheville, North Carolina. She is the chief nurse representative for her shop for National Nurses United, the union there. Hannah, welcome to the program. Appreciate your time.
Thanks for having me. Excited to be here.
Yeah, really excited to have you. So last week we got the press release about the rally in Tampa, Florida. I'm not sure if you were one of the ones at the rally, but Lucy said that you would be definitely one that would be good to talk about the issues at hand. And so, can you just talk to us about why y'all went down to Tampa, Florida? What was, why Tampa? Why in Florida? What's the deal with that? And what was the message you were trying to send?
Yeah, so I actually was one of the nurses at the rally, and we got together with nurses from all across the country. So my hospital is owned by Hospital Corporation of America, HCA, for those who aren't familiar, and they have a lot of hospitals in West Florida. So we are gearing up for our contract campaign coming into 2024. And I think something that's really unique about nurses is that our working conditions really affect the health and well-being of our communities. And in HCA specifically, we're seeing a manufactured staffing crisis. We're seeing a willful under-resourcing of staff, whether it be nurses, EVS workers, phlebotomists, techs, to maximize their profits and really prioritize their shareholders over patients and human lives. So we all took time out of our weeks on our days off to get down to Tampa, Florida, in front of the regional headquarters and let them know that we're here and we're ready to fight. And we are once again calling on them to put patients first.
One of the big things that y'all are wanting to attack in this cycle of contract negotiations is staffing levels, and this has been a really a theme across across a lot of these nurses unions and during contract campaigns. The Roberts Wood Johnson Hospital in New Jersey, they actually, I think this morning it was, just reached a tentative agreement, and the union says that they've agreed to some safe staffing levels. That's what the strike was over. They've been on strike for months now over safe staffing levels, and that's a super just to underscore for the audience, right? When nurses go on strike, it has historically not been about pay or salary, right? It's been about we just want enough people so that we can take care of people. What is the risk to me as a patient if you don't have safe staffing levels?
I mean, starting out from the top down, death is the first risk. If there's not enough people, like death is never not on the table when they put us in these situations. But it also means like your mom might not be able to get up and go to the bathroom, and I can't go help her go to the bathroom. So then she goes in the bed. In my hospital and our ER, it means that you could be stuck in a hallway bed for days. It could mean that your meds are late. It could mean that you have a longer hospital stay. You're at a higher risk for, hospital-related infections and just all kinds of worse outcomes. And we know this because when California and the work of California Nurses Association, which is under, the same umbrella as us with National Nurses United, their union pushed to get safe staffing written into their legislation. And when you look at their patient outcomes, they're better than anywhere else in the country. When you look at their turnover levels and their retention levels, they're better than anywhere else in the country.
Right. Yeah, can you talk to us a little bit more about that California law? Because I listened to, and I meant to re-listen to it before the show today, but I didn't have time. But a few weeks ago, maybe a month ago, Bernie Sanders held a a hearing on nurse staffing levels under the U.S. Senate's Health, Education, and Labor Committee, and had a lot of several nurses from across the country, including California Nurses Association, talking about this. And I can't remember exactly what the law required, and maybe you can fill that in, but the law basically said, look, you have to have X amount of nurses per patient. And that has resulted in, like you mentioned, nurse retention, but also better care for the patients, right? Is there any numbers that you can give us for that?
Yeah, so I think the most accessible level there is when we talk about like a medical surgical unit. When we use that word, that's kind of like the normal ward or floor that everybody thinks of in the hospital. That's the most stable patients that are in the hospital, may have a shorter stay. In California, the law is that that nurse has no more than 4 patients. So when that nurse goes above those 4 patients, the risk of patient death increases by 7%. And that's just within the most stable, least sick patients in the hospital. And what that means is that nurse is being given the ample amount of resources to care for their patient. They're not spread thin. Sometimes in my hospital in North Carolina, they've tried to give upwards of 6 or 7 patients to that nurse on the same kind of floor. So you're upping the risk of death to 21%, but you're also, if you have 6 patients over a 12-hour shift, and then over the course of an hour, that gives you like 5 minutes per patient. How are you supposed to get everything done you need to get done with 5 minutes per patient?
Right.
And those numbers, I think, really make it real.
Right.
Yeah, I wanted to jump in. I don't know if people know this. I'm also a nurse, so thank you for your service, by the way. But and I had no idea that was even a law in some place, but it makes total sense because where I work in an Alabama hospital, floor nurses can have 8, 9 patients at a time, and now with COVID numbers and flu surges, you got hall beds for ER, and they're kind of transferring those into hall beds for patients. So it's like you can't have 3-to-1, 4-to-1 caseloads and expect people to even physically be there in time.
And Hannah, I wanted to give you a couple other things about Alabama, and you can tell me how. And then I'm interested in hearing what are some of the, so 4-to-1 sounds kind of like the recommendation. That's what you said the California law is. So I'd be interested in hearing what if you're able to figure out what the average nurse to patient ratio is across HCA systems. I know that I'm sure it varies because, like you said, it's the largest hospital corporation in the country, which is, I don't know if it's a good thing to have hospital corporations. Maybe that's something that we could talk about at a later time. But
it's not. The short answer is it's not.
There you go. So okay, but so here in Alabama, and this is according to the Alabama Board of Nursing, a total of 38,727 experienced nurses in Alabama indicated that they intend, not that they have thought about, they intend to leave the profession within 5 years. Shared during a recent meeting of the Legislative Healthcare Task Force, the survey also revealed that based on current trends, nurse vacancies in the state could grow to as high as 14,000 by 2027, nearly double the current nurse shortage of 7,200. As nurses in Alabama are the second lowest median salary in the nation at $56,000, ahead only of South Dakota's $55,000, many have taken on second jobs, further contributing to burnout and eventual retirement. Of the 84,779 Alabama nurses that participated in the survey, roughly 58,000 of them have indicated they have a second job, 37,000 of which spend at least 32 hours at that second job. So I'm interested in your reaction to that, and then the staffing levels at some of those hospitals, and then if that is something that you're seeing across the country at these hospital locations as well, nurses having to get second jobs because they don't have enough money to make ends meet.
Yeah, I would say that's not a unique experience, especially in less unionized areas. But I really get a visceral reaction when folks use the word shortage, and our states and our governing bodies use this word shortage. We have more nurses coming out of nursing school than we ever have in the history of the United States. We have over 5 million registered nurses with a license in this country. Over 1 million of them are not working as a nurse at all anymore. And it all roots back to this uninhabitable, morally distressing, morally injuring work environment. When we see human lives and human beings not being valued, that weighs on you. We take that home with us. We got into this profession to help people. And, when I hear that 38,000 nurses in Alabama have an intent to leave the profession, there's no shortage there. That's 38,000 people who have a license. So that's once again a manufactured crisis. And like you said earlier, when we go on strike, it's not about money. It's always about patient safety. And I think if we saw similar legislation, and when I mentioned those ratios earlier, that 4-to-1 is just the most stable patients. Those ratios get less and less and less the sicker your patients are.
Right.
How many more people would stay in their profession if they weren't put in these difficult situations every single day, where we walk out and we feel like, oh my gosh, my patients didn't get the care they deserved? When it comes to HCA staffing, it's apples and oranges with the union HCA hospitals versus the non-union HCA hospitals. They've tried to give my nurses here in North Carolina, 10 or more patients, and we've been able to fight back. We're still not where we should be. We're often 6-to-1, but we see our counterparts in Florida who are not union that are taking 13 patients. Wow. That on the step down floor where you should be 1-to-3, you're taking 6 or 7 or 8. I just talked with nurses from Colorado at an HCA facility that are saying it's normal in the ICU to have 4 patients. The recommendation in ICU is 2-to-1 or sometimes even 1-to-1, and they're taking 4.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
Wow. That's that's horrifying, as that's horrifying as somebody. So my grandmother has had a stroke over the last few months, and now she's requiring 24/7 care, and she's back home, and the family's basically providing that care for her. We're taking shifts and stuff. My grandfather just had an incident where he had to go to the hospital, so I'm anticipating a lot of hospital visits in the near future, with my grandparents and the help that they're in right now. And that is, that's horrifying to hear. That my guess is just going to be that it's, especially given what I just told you about Alabama's, the way that our nurses are treated here, I don't figure it's any better here in the hospitals in Alabama. So, that's very, very scary to me as a a member of the community, somebody who has family members who are going to go to the hospital, who've been to the hospital, and who I've been to the hospital before. I have anaphylactic allergies and stuff, and I've had to go in the last few years for allergic reactions, and that's just that's very, very scary. And so what is the union proposing to address this in these contracts, and when do they expire?
So we expire over different timelines next year. My hospital is the last one to expire on July 2nd. We haven't sat down at the negotiating table yet, so I can't speak to specific proposals that we have. But what I can speak to is at my hospital, when we started our first negotiations with our contract, and we're a brand new union. We just won our election in 2020. We just ratified our first contract in 2021. We thought that the staffing that they proposed from the hospital when we got our union was pretty good. And what we asked was that the hospital uphold their own proposed staffing grids on our units. And what I've seen them do is violate that at every turn that they can, and then tout this nursing shortage as the reason why. But yet I see them invest in short-term solutions with travelers. I have seen, some years in multiple departments that I've worked at this hospital, over 70% turnover.
Yeah.
Wow.
70% turnover. So what we would like to see.
If we could pull out and sit on that tangent for a second about the travel nurses, which is not to, I don't think anybody is going to say travel nurse is bad unless you're like scabbing. Okay. That's a different, that's not good to scab.
Yeah.
But, just travel nursing in general, no condemnation there.
Mm-hmm.
But the how does that feel as a nurse there at these locations where travel nurses are coming in making, I know a travel nurse. I am like very close to a travel nurse who is now settled down in California in a union hospital, right? She's making a lot of money. But she did travel nurse, and she was at some places making $100 more an hour than her counterparts, right? And so why not, instead of paying 3 or 4 times for one person, why not pay the salary of 2 or 3 or 4 people and keep them there? What's the deal with that?
The math ain't mathin', right?
Yeah.
We've asked that question. But I know, in my hospital, if you have a traveler instead of a bargaining unit nurse, then they're not going to push back in the same way. And especially at HCA, they love to have temporary workers. They love to have new nurses, because new nurses don't know anything different in the working environments they're in, and temporary
work
workers
them as hard
are there
as you
temporarily.
need to. You can throw all sorts of rules on them,
and they're getting and they're getting paid, and then they'll leave. And just to really pick on this corporation that's in charge of the most hospitals in the country, that's also the richest healthcare corporation in the world.
Wait a second now, Hannah. So you're telling me that they're not sharing the pain with you as a family, right? You're having to work all these shifts and take on all these patients. Surely they're sacrificing, and they're not taking any additional profits or giving their CEOs raises or anything. That would seems like strange, because they're family with you, right?
They've seen record-breaking profits every quarter since the pandemic hit.
Wow.
I believe it's $5.6 billion already this year.
Wow.
Well, and I could speak
and
on...
that's from their own numbers.
And we've had 10 or 12 people just in my unit over the last year or two, especially after COVID, leaving for travel jobs, because when you're the second worst paying place in the country, and they'll be traveling 2 hours or something. It's not even like they're going to very far, and these are, this is a system that's within our state, and they're still outsourcing for whatever reason. It's absurd. Yeah,
well, and you mentioned that about how travel nurses are less likely to push back. That's such an important point. And my friend actually told me about this, right? She said, look, if I go to a hospital that's, treating me badly, I'll just put up with it for my assignment, and then I'm gone, right? And because... And there's a really great investigation in these times, The Big Business Behind Travel Nursing, by Alice Herman. I don't know if you've read this, Hannah, but I it's something that may interest you. But it talked about how how she talked to some people who had pushed back as a travel nurse, who then stopped getting calls to be nurses in different places, right? So there's, even perversely, as they're making all this money, they're kind of the most precarious.
Yeah, I mean, that's totally true. And, I think it speaks back to the bigger issue of why collectivism is important. And don't get me wrong, I'm thankful to have extra people in the door to help take care of my patients, because in the interim, we need people with skills to save lives, especially, my emergency department services 19 counties in Western North Carolina. That's so important. But you're putting yourself on an island as a traveler, whether you're in a union facility or not in a union facility. And, I think part of the reason we're all here today on this show is because we want good rights and good wages and good work environments for all workers, regardless of your trade. And we want to see these corporate honchos be held accountable and not be raking in on these profits while we have people getting injured and people suffering and people dying on the job.
Right. So y'all are going to be pushing for safer staffing levels in your contract negotiations across HCA in 2024. We will keep an eye on it. Feel free to reach out if you ever, if there's ever anything that you think our audience ought to know about. And happy to have you on again. You've been great to talk to, Hannah. I appreciate your time. Is there anything else that you think that right now you'd want to make sure that our audience knows before we let you go?
I would just say if you have nurses in Alabama who want to have the good things that my union hospital has, reach out to the National Nurses Organizing Committee. We're ready and fighting already in the South, and we got your back.
All right. Thank you so much. Appreciate it, Hannah. You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.